Greetings and welcome to AWHONN Insights, the home for candid nursing conversations. Today, we're highlighting the many opportunities that exist to build the nursing career pipeline with funding for students at all levels, from a storied institution, UNCF, and at the schools of nursing at historically Black colleges and universities, also known as HBCUs. Our guests are Dr. Alyssa Harris, Dean and Professor at the College of Nursing at Prairie View, A&M University in Texas, Cynthia Hearn, a Relationship Manager and College Success Coach with UNCF, Ambrose M. Price II, a Senior Relationship Manager also with UNCF. I'm your host, Bria Anopise, and I'm joined by co-host Lakeisha Ballard, a clinical nurse education specialist in L&D and member of the Maternal Mortality Review Team in Maryland, and Kimber Stovison, a labor and delivery nurse and student midwife. Lakeisha and Kimber, the podcast is now all yours.
Thank you very much, Bria, and welcome everybody to our great informational session we'll have today with our people that have joined us. So we have Cynthia, Ambrose, and Dr. Harris, and Kimber. Welcome, welcome, welcome. We're going to go ahead and kick this off with Ambrose with our question. So what is the history of United Negro College Fund, and how do the opportunities we discussed today increase healthcare workforce diversity? Oh, you're on mute.
Thank you for that question. Good afternoon, everyone. I'm happy to be here. UNCF has been around for a minute. It was incorporated on April the 25th, 1944 by Frederick Patterson and Mary McLeod Bethune, who are icons in Black history. We are headquartered in Washington, D.C. I like to think we have helped a lot of students with a lot of money, probably over $5 billion since we've been incorporated, and probably over 500,000 students. What's exciting about that is that Cynthia Hearn, my colleague, and I, and my other colleagues at UNCF have probably touched all 500,000 of those students individually. So it's really an impressive operation. It's been growing considerably over the last few years. What's the second part of your question again, please, Lakeisha?
It was how to discuss today's increase in diversity and workforce diversity with opportunities.
Excellent. Okay, thank you so much for that. UNCF regularly posts scholarship applications on our website, opportunities.uncf.org, and they cover a wide variety of programs, majors, interests, and things like that. So it's important that a student plug in, set up their profile, and actually, I like to call it go fishing. You put as many lines in the water as you can to match your eligibility criteria, and you see what you're going to reap from it. But I certainly know I personally manage a few programs that have looked for STEM majors, which I was able to certainly look for those people in nursing field, and also had the opportunity to help a couple students that were in the midwifery program, which I found especially intriguing. So hopefully that helps to get us started, and I thank you for that.
Thank you. Thank you for giving that great answer. All right, we're going to hop it over to Kimber. She has a question.
This question's for Cynthia. So we know that relationship building is your specialty here, and that relationship building really contributes to the success of students. So what is your role in pairing students interested in nursing with mentors in the field?
Great question, and thank you. And that's actually one of my passion areas. We have actually developed a brand new mentorship program, which pairs our nursing students as well as other disciplines with a mentor. We actually had our very first meeting, pairing meeting with our mentors and our students. We find mentors through various associations, professional associations, American Nursing Association, AWHONN, various professional associations, as well as just former students and alumni of our program who are interested in giving back. So that's our effort, and so far so good. We've been able to secure 29 mentors, and we have 39 students, so we're still looking for a few mentors, and our efforts are paying off. What we find is through the surveys and the questions that we send out, most of the students are interested in professional development, growing their careers, and asking questions about how do I, through a mentor, secure a job in the field where I can grow. So it's been fruitful. I've done this at a few other jobs that I had previously in the higher education. So it's really important as well. Some of our students they have no idea, moving forward, how to best secure their jobs, grow in the field. Most of our nursing students are RN, associate level RN in my program. So they are very interested in going to that BSN Bridge program and moving further into the other higher education fields.
I I think the importance of a mentor can't be stated enough to just have that guiding hand to kind of help you figure out what your path is. It's nice to know that you don't have to make all the mistakes on your own, that sometimes people have done it before you and they can give you that advice. So I really appreciate that. You mentioned that you've worked with AWHONN, finding mentors. Is there any advice or things that our members or listeners can do to become a mentor for your program?
Certainly. We're always open to inviting in people who are interested in mentoring upcoming, professionals in the area. So, um, at the end, hopefully, we'll be able to provide you guys with the contact information of myself, Ambrose, so that we can have the direct contact. We are always open to have that conversation. Thank you for offering.
Thank you. So, Dr. Harris, being the dean over the School of Nursing at Pearview A&M, we know that historically and currently there are not as many nurse scientists as we would like to have here in the U.S., especially Black nurse scientists. We make up less than 5%. You can correct me with that quote.
Yeah.
Less than 5% of Black prepared PhD nurses are in that field. So, what are HBCUs doing to help contribute to growing nurse scientists currently, nurses with PhDs?
So thank you. It's my pleasure to be here this afternoon. So I think that our role at HBCUs is to provide education and give students the skills so they can transition to those programs. So currently there are no PhD programs at HBCUs. So students wanting a PhD in nursing need to transition to a primary white institution. So I see my role as the dean at Prairie View is really taking the time to educate students about what a doctorate in nursing science would do, what being a nurse scientist is, and why it's important to think about those roles. So we are the individuals, nurse scientists are the individuals that go out and do the investigation, do the research that look at all the things that are important to underrepresented and minority populations. So I see my role as providing education and then helping them transition to those programs and then supporting them while they're in those programs. Often students don't know about what a PhD in nursing can do for them, why it's important. So just providing that education and then shepherding them through the process. Also, people are really scared about writing a dissertation. They have no kind of knowledge. And that was, for me, that was one of the reasons that held me back for so long. I was like, oh, I can't write a dissertation. But really, when somebody breaks it down to you and explains how this works, it really is kind of an easy process. And it's a long process, but it's a doable process. And that's the piece that we want our students to understand.
Good. And, there's been a lot of conversation about introducing nursing, even to the level of elementary and middle school, in the different ways we affect change in our communities politically, inpatient hospital systems, corporations. How do you feel about that? What are your thoughts on introducing the nurse scientist role, the nurse, someone who works in academia or who may work in a hospital system. What are your thoughts on introducing these subjects earlier, even in elementary?
So I think it's an important topic of conversation. Just like we talk about all professions, we should talk about nurses too. So what I usually tell people is that nurses are the backbone of our communities. We live with everybody. We know what's going on in our communities. We know how people access care. And so we're the ones who are advocating for them. Lots of people think of nurses as individuals who just change dressings and pass medications and things like that. We actually do much more than that. We're the ones that are connecting you to physicians, providers, other services. We're the ones who are talking about what's happening in our communities. Is there a bus line that's running? Because if you don't have a bus line, you don't have any transportation, then how are you going to get to your provider? We're the ones who are kind of the eyes and ears. And so I think that introducing nursing and helping people understand there's more than just the bedside nurse, even though that is an important role. There are other ways that you can think about nursing. I was just having a conversation with a student this afternoon. She was wanting to think about the law and applying that as a nurse. And so we talked about maybe going on to law school, right? Because there are all sorts of malpractice, all sorts of things like that, cases, insurance claims, things like that. And those are roles for nurses too. So there's a way. What I usually say to people is that nursing is what you make of it. You can use the degree to go in any way that you want, and really does impact everything that we do. Health impacts everything. So we are the eyes and ears, I think, of the healthcare system.
I absolutely agree. Thank you for that. There's definitely different roles that we can go into, and those things need to be amplified in which, people may or may not see themselves in. So thank you for saying that. It's very good. Thank you.
Ambrose, this question is for you. So, we know that college applications have been declining for over a decade. I think a lot of that is due to the cost of college and education. So, what is the criteria for receiving UNCF scholarships or grants for students interested in nursing?
All right, excellent question. Thank you so much for that. I mean, we certainly have to start with registering on UNCF's website, which is your profile. I always ask students to really spend some time with your profile, because your profile is going to be kind of a static resume online that shares important details about you, such as your educational background, your degree aspirations, your classification, your GPA, and it allows you to put in some essays. And there are only a few different topics of essays that you'll find. So after you get your resume set up, then you're available to go in and look in our sandbox for different programs that you may be eligible to receive. Um, it is important that a student read carefully the eligibility requirements on our website. I can't tell you how many times you receive applications from students that says we are looking for STEM majors, and someone's putting in an application that says they want to be a history major. Now, to Dr. Harris's point, there's a way to connect these dots, but you have to think about it. Essays are also, you have to understand that as program manager, Cynthia and I, that's pretty much what we do most of the day. We read applications, we read essays. We read applications, we read letters of recommendation. A lot of our programs will ask you for a letter of recommendation. It is troubling for me to see students who either have not completely read the eligibility requirements that are happily submitting the completed application, essay and everything, but no letter of recommendation. The eligibility requirements clearly state you must provide a letter of recommendation. Without that, your application packet is incomplete. So that's one thing, certainly to pay attention to what's listed on the application splash page, which when you first hit it, you're going to see this happy guy. You need to scroll down. Don't immediately hit the apply now link, which will keep you from scrolling down to seeing the other eligibility criteria. So that I would certainly want to stress. Additionally, the essay is important. Program managers design their own rubric to score applications. We take different weights for different topics, GPA, letter of recommendation, leadership activities, things like that. So you want to make sure your essay is well constructed. Again, back to a business major in nursing, you can connect the dots. And it's beautiful to see when students are thinking that way. You'll see them take experiences that may seem to you to be a little left field, and they will tie them right back into what they're trying to accomplish, such as this taught me the leadership abilities or the skills that I needed. This taught me how to organize my time and to work with other people. This taught me how to collaborate with others. So, those things I'm looking for, I'm sure my colleagues are probably looking for the same thing because, again, we read them every day. You'll start to see patterns with students who are thinking, in my opinion, clearly about where they've been, where they are, and where they want to go. And if you're looking at nursing, that's what you're going to want to look for. Make sure you tie your essay into whatever you want to do according to the eligibility requirements. If you're, and so the other thing I would state is be sure to include your transcript. We don't need official, unofficial is fine. And the programs that I've managed that are looking for STEM majors fall into two categories. One is what's called a need-based scholarship. Need-based scholarships require a student to complete a free application for federal student aid, also known as the FAFSA. The FAFSA typically comes out in October. I hear this year it's going to come out in December, which is an improvement. We had major changes in FAFSA delivery over the last couple of years. So you have to do your FAFSA need-based, and then we receive that information, or actually the institution does, so we know after we ask the institution for verification for your enrollment and financial need, we'll get that information back from the school, which will allow us then to make the determination as to the amount of your award. And then the other type of scholarship we offer is a merit-based scholarship. So merit-based, it took me a minute to understand the difference between the two, but merit-based, we're talking about show me what you got. You got 4.0 on a 4.0 scale? I like you. You got an essay that shows me you know what you want to do with your life and structure? I like you. Community service and involvement? Hey, pay it forward and share your gifts with your community behind and reach out for those to mentor you along the path. So I like to say that as well. The GPA requirement will vary according to the program. My program that looks for STEM majors in the associate's level, we have a 2.25, I believe, GPA requirement on a 4.0 scale. I have another program that looks for STEM in the traditional sense. We're looking for a 2.5 GPA, or actually a 2.75 GPA. I have a merit-based program that looks for STEM majors. 3.0 is their requirement. So you can see it's going to vary by the program. It's going to vary by the donor. They want different things. They're looking for different things. And at the end of that cycle, let me say this. If you are selected as a recipient, congratulations. You're probably going to get a award notification from UNCF that says, congratulations, you received this scholarship in the amount of X dollars. Send us a thank you letter and a headshot photo. In my opinion, it's the least we can do to show our gratitude to the donor and reinforce their position as to what they're doing with their money. Because our development officers at UNCF work constantly to develop new donors to help finance students' education. And we want to make sure that they are appreciated and respected in that manner. So a nice thank you letter. We even provide you with the guidelines on how to craft it in case you're not sure. That's okay. We all have to learn at some point or another. Craft your thank you letter and a headshot photo. Headshot photo is kind of like here on up. I've received all kind of pictures, and I'm like, not quite sure that's headshot, but we'll work with you. We'll work beyond that. So, it all is driven by our opportunities.uncf.org website, and take the time to look at our other things on our website. There's quite a bit of information out there. We've got some great brand marketing communication people that have really provides a tremendous number of resources out there on the website. So hopefully we got a little bit of that question answered for you, and we'll go from there.
That was a great answer to the question. There were a couple of things about it that I really liked. I like that you spoke to like applying the skills that these students and participants have and applying it to a broader sense. I think a lot of times we take on so many different roles and we don't realize that like some of the roles that we might take on in nursing applies to far farther than just at the bedside or in our particular job duty. And then I also like that you explained just how vast the criteria are for receiving some of these scholarships. I think some of the barriers to applying sometimes is just people not believing that they qualify or they can do it. And I think it's important to realize that you're going to miss every single opportunity that you don't reach for. But it sounds like there's a lot of opportunities within the UNCF for people, to receive funding and help and mentorship, uh, should they just get out. And I think that's an important point to, point out to our listeners that apply. The worst that can happen is that someone says no, but someone else could say yes. So, thank you for that information.
Let me add, I have a little something to like to add on to that. We often find, especially with my non-traditional students, they're working. You know, they've been working, maybe supporting the family or whatever. So when it comes to that question, like, tell me about your leadership or your community involvement, it seems to stump them. They're like, well, I don't have any leadership because all I've been doing is working. I'm like, are you kidding me? That's tie that together. You definitely have responsibilities. You may be supervising other people. You may be training. So again, think about it in a broader sense. You are your own brand. Promote yourself appropriately.
You spoke about some of your sponsors and donors for some of this scholarship money, scholarship and grants money. What are the best steps to market funding opportunities for our communities to support UNCF?
Opportunities for our community. You know, our development team is pretty darn amazing. We have satellite offices pretty much all around the country, which was amazing for me. Houston, Atlanta, LA, New York, Chicago, they're all over. And so the development officers, that's their task to reach out into the community, to develop relationships with individuals and organizations, corporations who are interested in joining us in this work. And we certainly recently released an impact statement to prove through the numbers that what we're doing is making a difference, and that is certainly wonderful to see. So, if there are organizations within your community or collection of individuals that are interested in working with UNCF, let us know. We will certainly connect you with a development officer, and you guys can start that conversation. The vast number of programs that we have are uniquely tailored to each donor's individual needs, which is pretty cool to see as well. I have a program, for example, sponsored by the Daughters of Charity. Now, I'm familiar with the Daughters of Charity as the nuns with the habits that look like the flying nun. For those, I'm dating myself, but their core principles are rooted in helping the poor, education, and so their requirements are looking for STEM and education majors. So you see what the donors' interests are. They align the program with their interest, which may also serve as a pipeline for students and internships as the pathway to getting a full-time position with their organization. Again, a beautiful thing to watch the synergy come and work together. So if you have organizations or communities that are interested in being involved with UNCF and helping support our cause and helping these students get these resources that they desperately need, just reach out to Cynthia or me, and we will certainly get you in contact with the right individual to continue that conversation.
Thank you.
Okay. Thank you. Thank you for that. So, Cynthia, so reimagining, we always want to try to reimagine how we can do things differently because as things fast track over the years, how can we reimagine how to market students outside of the traditional classroom. Um, Providing information to nursing students, excuse me, outside of the traditional classroom.
So, yeah, I was contemplating on that question earlier today, actually, and I had a great example of one of the programs that we support. So, mentioned non-traditional and a non-traditional path. As an example, we support a direct to entry midwifery program. One of the schools up in Wisconsin has that program, and we've had a couple graduates from there. They started off as doulas, and so they don't have college degrees. They're high school graduates, but they don't have college degrees, and they were direct to entry midwife. They were in the direct to entry midwifery program to become a midwife. So programs like that crop up, and there are probably more that truly we're not aware of. I think if we did some additional researching on non-traditional programs for people interested in healthcare, particularly in the nursing field, we could probably support those additional programs. Um, our program, one of the programs that I manage, the Healthcare Workforce Diversity Scholarship Program, is one of the pioneers of such programs at UNCF. UNCF didn't really have a great deal of programs that support associate degree certifications and programs like that throughout the country. And so this one was developed, and we specifically look for those non-traditional type students who are in certification programs to fund them. Again, our whole basis is to help get them started in whatever program they want and then take them further down the line. You don't have to stop at just getting your certification in midwifery. We can help you bridge through getting a degree. So I think seeking out other programs that are probably already in existence that might not be aware that they can have monetary support as well as surround support that our program provides is the start to getting that started to find those non-traditional routes to get those students that are not necessarily in 4 year 2 year or 4 year degree programs.
And I was wondering, as you were talking, especially trying to collect that information, like
Mhm.
how to collect that. So, collecting from the people who will be in the programs, what are some ways that would entice them to be in these different fields or in nursing or different ways that's not really traditional? How does one gather those evals or those surveys and say, oh, okay, because someone or somewhere, of course, a lot of people have great ideas and information, but it seems like that's where we're going. We talk about STEM, we talk about AI. We really have to continue and not to use that, slogan over and over again, but really think outside the box because things are moving in a real fast track. Though we need strong preparation and readiness in healthcare, 100%. So we don't want to fast track it to where we're going to make mistakes along the way, but also making sure that we're being very creative in this space that we can grow the people because we have to grow our community. So, yes.
Definitely, and that's why our primary program is the Healthcare Workforce Diversity Program. It is specifically tailored to diversify our healthcare environment. The whole concept is, the patients a lot of times. Um, Especially in rural areas and certain areas wanna see somebody who looks like them, and they're more comfortable seeing somebody who looks like them. So our target is to reach out and do the research and find those, the schools and organizations that support those kind of students. Um, we also have a great outreach team that goes to the high schools. We're not gonna only just start at the college level. We're gonna look in the high schools, and our outreach team goes in the high schools. They talk about, these different professions, see where the kids are interested, let them know how they can get funded and involved. HBCUs are so big right now. And so, of course, we encourage the kids, the high school kids, to think about HBCUs in general because there's so many opportunities for those kids and going to a HBCU right now. So I think continual outreach. Um, we do use a clearinghouse, a system. We also have a department that gets that information, that brings information on out from the public, that shows us how many kids are in, or how many students, or how many first generation students there are that are interested in nursing, or becoming a nurse anesthetist, or becoming a physician assistant, or whatever the case may be. So we have a clearinghouse, and we pay for that information because it's instrumental for our success in programs like the diversity healthcare diversity program. So just continuing to do the work, like you said, thinking outside the box, that comes along with the type of outreach we do. Just to add, UNCF does host webinars, public webinars, by our outreach team, and they're road warriors, to say the least, so that anybody interested in learning more about the opportunities, um, resources that we have available. We also have a department specifically that helps them once they are in school. They can get an externship for their professional development. And we are always seeking students who need an extra push in the area of professionalism. So there's things out there. It's just getting the word out, and we continue to try to do that.
Now, this question can be for anybody, and as you're talking about that outreach, how does one from the United Negro College Fund or for a school of nursing like Pearview or other HBCUs, how difficult could it be to reach out to, let's say, you know, a Tyler Perry or a company to want to invest in a certain program or funding? Is that something that has traditionally been done? Or, a lot of times they may donate. Well, I want to donate $10 million to this university or this school. We hear about those funding through different companies. But how is that done with you're reaching out? Or is that done to acquire funding from particular people or companies?
I think so. I think it is certainly done, and it's really about networking, introducing yourself to people, telling people about your story, about your school, and reaching out to a Tyler Perry, his circle of friends. Who knows Tyler Perry? Who knows that he might be interested in whatever film, health, whatever. You never know what's in people's backgrounds. And sometimes those little nuggets of information, just reaching out, sending an email, talking about what you're doing with your program is just enough to pique their interest. And then you can make a connection and then talk more about your program and why the need is. And so, certainly, as Mr. Price said, students sending those thank you letters and telling the donors and the funders how much that money meant to them, that they were able to, to complete their education. They got a job doing this. And what you often find is some of those students keep in contact with those donors for years, right? But we have an alumni association that mentors our nursing students, and they're phenomenal about keeping track of students and reaching out. And they don't have lots of money, but they give back all the time because it's that connection that you have with the donor that does that kind of keeps you connected to the school and keeps you grounded in the work we're doing.
These connections are so important for the success for like successful careers. Um, I want to bring it back to when you mentioned like how you encourage the students to go to HBCUs. There's something that's really special and remarkable about being surrounded by Black excellence and seeing people like in the same path and the same journey and at different steps of the same thing that you want to see or do. And I think it's important to realize that not everyone gets an opportunity to see that kind of community built around them and see people that look like them, especially in healthcare. Um, Dr. Harris, I wanted to turn this question to you. So we know Prairie View A&M University granted its first degree in nursing. We were talking a little bit about the non-traditional classroom or non-traditional candidates. Prairie View A&M offers popular tracks for nursing that are more difficult to access, like the bridge tracks, LVN to BSN or RN to BSN. Can you share why those bridge programs are important for increasing diversity within healthcare?
So typically, what we know is that underrepresented students often start out in associates or LVN tracks. And we really want those students to continue on to get the baccalaureate, master's, and doctoral degree. And so those tracks are important because, I started out as an associate degree nurse and then worked my way through for the rest of my education. And it's making those connections that help you see the next level that you can or achieve. So those programs, we really try to work with students. Sometimes those students, when they initially leave high schools, aren't able to get into traditional programs. So they start out with associate degree programs or LVN programs, do well in those programs, and make that transition to baccalaureate education is much easier for them. So they have some more time to kind of, sometimes they're younger, they're not quite sure what they want to do. It's learning to prioritize, learning to study, and things like that. And those non-traditional programs give students an opportunity to kind of find themselves, but also figure out whether this is the passion for them. And then they can manage the work-life balance. Oftentimes, those students have kids and other family members they're taking care of, so going to school part-time, and then being able to graduate sooner and work and then continue on to school part-time, do those other degrees are really helpful. So we like to encourage students, if you're in an RN, an associate degree, to come back for your bachelor's degree. If you're an LVN, to continue on for your baccalaureate degree. The money, the financial gain that you will get over the long haul will be much better for you and your family. So it's important that they continue. Also, it's important that they continue with those advanced degrees so that we can be at the table, right? So we want people that look like the community that we're serving making those decisions at the policy level, the local, mayor elections, all those policy implications. We need us at the table to advocate for all the things that we see in our communities. And so that's why it's important for us to continue our educational journey, because we need to be at the table with the credentials that they'll recognize, so they'll listen to what we have to say.
I think you hit the nail on the head there. I too am I got my associate's degree in nursing first, and a lot of the points that you made are exactly why I chose the path that I chose. I was a non-traditional student. I wanted to make sure it was affordable and I could pay for it, and I wanted to start working as soon as possible. And I found it to be extremely helpful to be working within the healthcare system as I was deciding like what my next steps were. Not only because financially that was helpful because, you do have opportunities that you weren't aware of when you're working within the field and working with your colleagues, but also you kind of get an idea of like what is actually like boots on the ground and what path you want to go towards. It's a lot different thinking of it in theory versus being there in person. So I think what all those points that you made are, I mean, it was like reading my diary right there.
And so I think that's a good point. What I also tell students too is to reach out to people who are going through the process. Talk to them, ask them for advice. How'd they do it? What did they, who did they speak to? If you're unsure, connect with somebody in some of these groups. So, AWHONN has mentoring. There are other nurses that are part of AWHONN. Other organizations, people let you shadow, people let you spend time. We are, as nurses, we're really good about wanting to bring each other along. I always say you need to reach back and pull somebody along with you. And so that's important. So reach out to the state nurses associations, to the specialty organizations, all the schools. They'll connect you with people and you can have a conversation and think about, is this the right thing for me? Or how do I do it? They often know information, funding sources of things that you wouldn't think of as a layperson on the street. So it's important to connect with individuals who are in the field.
And listening as you climb allows you to be surrounded by like-minded people. Like if you're trying to change it for a better place, like the people that you meet along the way, what better people to have at the same table with you?
Yes, absolutely.
So true. Dr. Harris, and being a proud HBCU graduate myself, undergrad at the North Carolina A&T State University, and now in a doctoral program back at North Carolina A&T in a DMP program. My last question for you, and of course we need the funding, right? Funding from UNCF. What are some leadership positions, or what are some things you feel that the DMP nurse, the PhD prepared nurse should really be focusing on? What is something you see in the future that we really need to be at a seat at the table as we join together, because we know, PhD, DMP, we're all leaders, but what are some things you feel like we really need to be focusing on that you see coming down the pipeline?
So I think we need to pay attention to AI. A lot of us don't know a lot about AI, and I think it's important. It's really impacting healthcare and healthcare decision making and driving system change within the healthcare system. So we need to focus on that. I think we need to focus on maternal child health, morbidity, and mortality. I think that we need to focus on population health and the environment. How is that going to impact the care that we're giving patients and their living conditions? All of those things. I can think about. I was telling somebody it's homecoming weekend this week at PV, and it's 90 degrees here in Texas. And when I arrived here 4 years ago, it was like 40 degrees, and I'm like, wait, what happened? So the environment has really changed. I think I'm wearing shorts to homecoming parade on Saturday, but those are kind of like these bigger system issues, right? We also need to think about how we can ensure that diverse nurses are being included across the pipeline, right? So we want more nurses to be in DNP programs and PhD programs. And how can we get our larger organizations to support that? And that's more of us at the American College of Nurses and those big organizations that set nursing curriculum and policy. We need to talk about the impact of these changes and these policies on diverse and underrepresented students. And so I think as a combination DNP and PhD person, we think about the nursing, the PhD person as the person who's looking at the science, and the DNP who's implementing the sciences. We need more of those teams, right? So what are we going to do about maternal morbidity and mortality for African American women? It's really astounding, and it hasn't changed in over 100 years. So how can we together move that needle? Like, what is it? Do we need to look at the way that we're measuring things? Is there a different way we should measure things? Do we look at things that are going on in the community that's impacting us? So, and we need to think about how all these changes in the healthcare laws are impacting our community. And we, as nurse scientists and people or scholars, need to ask those hard questions and then get together and figure out how we can solve them together as a team. So those are big things that I think of right now. I think it's important that we need to think about the biomedical industry often. So it's interesting. This summer, I had a group of STEM students come visit the College of Nursing. They couldn't figure out why they were here. And I'm like, have a bunch of adolescent boys who are interested in computer science. I'm like, well, who do you think is making all of those machines that are keeping everybody alive, right? And so think about the healthcare career, right? Those are important things, all the new gadgets that nurses are using. Nurses are developing things that are being tested at the bedside, right? There are a lot of nurse entrepreneurs that are developing devices that are measuring baby, whatever, oxygenation, those things. All those things are important, and nurses are involved in all of those things. So we need to think about how we can impact society more broadly, and how can we team together as nurse scientists and people who implement the scientists and give us feedback. Hey, that didn't work. Y'all need to go back to the table. That's all important for us to understand and know about.
Thank you. I think that was very comprehensive. And I would love to talk to those young men about biometrics, because they need a seat at the table. They will and can have answers for our morbidity rates and ways we can change what we're practicing, because we definitely don't have all the answers, but usually someone in the room does. And, so
You know,
you get
I
better.
think part of that is recognizing that some of our the ways we do things don't work. When I think of STEM and your example, I think of how the pulse oximeter, which seems like such a simple thing, doesn't work as well on dark skin. So it seems like such a tiny little detail, but like it makes a huge difference in both over treatment and under treatment. Or the way when you were talking about measuring things, I know in neonatal healthcare, when we're talking about assigning APGAR scores to baby, if we're using skin color and we're looking for a blue color, a pale white baby and a dark brown baby is not gonna present exactly the same. But it's like until we have a seat at the table where we can bring these points out, someone else might not be as aware or cognizant of the fact that there are these subtle differences that actually make a huge impact on the way we care for patients and our outcomes. So I think that's a really important point to kind of bring to the table is that like really all of these different aspects of education are connected, especially when we're talking about community and population health. So thank you for those little tidbits to think about, and hopefully our listeners are getting inspired to bring forth some more great ideas to improve healthcare.
Thank you.
Well, thank you guys. And, this conversation has been amazing. And unfortunately, we are running out of time. So we're going to have to bring this to a close. Thank you so much, Cynthia, Ambrose, and Dr. Harris. We definitely want to hear more from you. Thank you, everybody, for tuning in. And Kimber, my amazing co host, and Bria.
Well, I have some closing words before you all go. I just want to say thank you to Dr. Harris, Cynthia, Ambrose. We're grateful that you joined us today to share your knowledge about the many opportunities available to support those who are interested in the nursing profession, as well as those who want to take their career to the next level. And thank you for the lives that you all have personally touched. We got that number at the beginning, Ambrose. And nurses are the backbone of the community. They've been the most trusted profession for the last 2 to 3 decades, and we need so many more. We're all aware of the shortages throughout the U.S. So you all have delivered some encouraging news that there are programs, there are networking spaces that are available for anyone who's ready to advance. So I love this forward-thinking solutions that we can all contribute to. For our listeners, thank you for the privilege of your time today. We hope that you learned something new and how you can get involved with UNCF as a donor or as a mentor. And you can also get involved with those who are on their way to becoming nurses at the many HBCUs here in the U.S. If you'd like to re-listen to this episode or to share it, go to awhon.org/podcast. You can also listen on YouTube, Spotify, SoundCloud, and Apple. If you go to our website, you'll see the full bios for our guests. You can follow them on LinkedIn because definitely they want to connect with you. And we thank you so much for your time. Leave us a review about how you enjoyed this episode. Be well and stay safe.